Welcome to the Ailm Practice Education Series in partnership with Firm Media, delivering concise and impactful insights for aesthetic and specialty medical practices. Your host, Chris Solhonik.
And today we have a very special guest, Jamie Leos from OMS Powerhouse Consulting. In today's episode, we're going to discuss team relationship intelligence, better case acceptance, and revenue cycle management. Jamie, welcome to the show. Can you please tell us a bit about how you ended up as a medical consultant or specialty medical consultant?
Sure. Thank you, Chris. I started my journey in the medical field right out of college. Started with a large healthcare organization and ventured outside into private practice and went right into a specialty practice and landed in oral surgery about 10 years ago and just found my niche. I like that it really bridges medical and dentistry together, and it's a very unique specialty. And I found I truly enjoy working with the specialty practices, and that's where I've been since.
Okay. Well, I'm super glad you're on the show today. We've recorded several episodes of the Ailm Practice Education Series, and we've been touching a lot on how to run healthier practices. As a marketing agency, I don't know if you know this or not, there's a common problem or situation where we generate leads for the practice, but this general scenario is we can lead them to water, but we can't make them drink. And for so long, it was really the practice would say the marketing wasn't working. And now we're really starting to see that there might be some work on the side of the practice to start getting better at sort of dealing with patient leads and creating healthier relationships within the practice. So the marketing dollar is actually being used in a more effective way. I can't wait to ask you the questions today about the stuff that you've been working on. So the format of the show is to ask 3 hard-hitting questions. And these 3 hard-hitting questions obviously come from you and I having conversations about the most important things that you're working on with practices. And then what we try to do is, in your answers, come up with sort of the best concise answers for people to be able to take that step back to their practice and apply that information. So if you're ready to get started, I'm ready to jump in too.
Let's do it.
Okay, great. So question number 1, what is team relationship intelligence?
Yes. Relationship intelligence refers to the ability to manage, understand, and optimize relationships, both personally and professionally, by recognizing the dynamics and emotions involved in a relationship. It's the ability to adjust your approach to have a more effective interaction and or effective outcome. It is most certainly a vital aspect of leadership and interpersonal communication for sure. We have kind of a saying in the industry that high-performing teams are either built or broken on one thing, and that's relationships. And decades of research support the data that correlates a team with high relationship intelligence builds trust faster and outperforms other teams.
Sure. So I know this because I've taken the sort of test or quiz that you give out, the assessment. Thank you.
Yes.
Searching for that word. And so I know about this, but can you tell our listeners and viewers a little bit about the assessment process and what kind of information comes out of it?
Yeah, the way Core Strengths approaches relationship intelligence is it has a very robust, complex assessment, and it's called the SDI, which stands for Strengths Development Inventory. And it takes 3 critical aspects of an individual and how you perform in the workplace. Who you are at your core, what motivates you as an individual, and just what you value at your core, right? Your core values don't change very much. It has then how that changes in conflict. And conflict is, I like to call it problem solving, especially someone in an administrative or management role. You're constantly processing and triaging. Do I deal with this now, or can this wait? What interaction didn't go well? And so you can enter in what they call conflict, and how then your motives and your form of communication changes. And then lastly, it has your strengths or behaviors, your top strengths or behaviors, what you tend to utilize most in the workplace. Not one is good or bad over the other. It's just awareness of, I use this strength behavior well, and it's bode me well so far in my success. So I tend to use it the most. And then the flip side is the overdone strength. You can have a strength that you utilize so much to the point where it starts to get more of a detrimental outcome rather than what you intended the original behavior to be. And then it ties it all together about the reasons why you as a leader or as a team, you recognize where that individual might be coming from, how to recognize potential triggers, and to make all your interactions that much more intentional to have this more effective, functional team.
Okay. So the question I have as a business owner, and I'm wondering if the answer I'm looking for is a little gray and less black and white, right? Are there specific core strengths that make for the best or good team members, or is it a blending of those strengths that make it work?
That's an excellent question. And it's one question that I actually address in my leadership master's class that I host with leaders. And that's often asked by practice owners or stakeholders. And the answer is there's not a single 1, 2, or 3 that makes one leader more effective or more successful. It's that leader's ability to adapt their approach based on who they are working with and the environment they're in. That's the ultimate higher level that makes you successful. You can be a very competitive person and you can be working with a person that is more distant. And if you recognize your different approaches, you can still have an effective interaction and come to a really great outcome more efficiently.
So, which you're saying some variation of compromise and communicate and all the things that are really hard for a lot
Yes,
of people.
I call it grace, granting people grace in those situations. Yeah.
Sure. Okay, so next question. How does relationship intelligence apply to running a healthy medical?
Yes. So envision a circle graph and you business objectives. So your market, your customer product in one circle. Then you have your people strategy, how you hire, how you develop, how you manage, which the platform is a huge part of a tool to manage that. And then you have your brand promise. So your purpose, mission, vision, values, and the culture that you want in your practice. That overlaps into a great sweet spot. And that's when you obtain relationship intelligence. So relationship intelligence connects all those things. It connects your people strategy with your business objectives to deliver your organization brand promise. And when you achieve this, I say for lack of a better term, it's a feel. Your team is this high functioning, well-oiled machine from front to back. And it creates this environment that empowers employees through development, open communication, and fostering a sense of purpose, which encourages them to take the initiative and ensure that no opportunity is missed. When you can create that environment where there's that innate desire to succeed, to do well, to help each other, then it creates this amazing practice functioning together. And that directly overlaps into your patients. Your patients see it, they feel it, how they're treated, how they're received directly correlates into your patients. I have had patients who literally have said, I just had the best experience from the beginning to the end, from when I walked into this office, from when I went to the back and how they handed me to the front and I received my treatment plan. It's just, you guys are just such a great team, right? That is a huge aspect into, selling or instilling the value in the treatment that you're proposing to this patient. A lot of the treatment's elective. So if they come in and they immediately feel better about themselves, they immediately feel safe and secure in your environment, making a big choice, that's already a big step in the right direction to getting case acceptance.
Sure. So as a marketer, I often think that the best marketing is done when branding is done first. We like to consider Firm Media sort of a branding first agency, and a big part of branding is brand positioning. So you described a picture of a Venn diagram where those two things cross over. In the middle there, I'm paraphrasing, but I think what you said is deliver on your brand promise. Is that
Right.
accurate?
Yeah.
So
Yeah.
as a
Mhm.
marketer, my question is this. Do you think that sort of running sort of the program for relationship intelligence with a practice would give a practice a better idea of what their brand position might be?
Oh, yes, absolutely. It's a critical role to align the entire team, whether we're working with leadership or if we're working with stakeholders or if we're working with an entire team. A huge part of is understanding who you are as a team. What's your ideal team, and what culture do you want to create? Because that then exudes from the behavior, the actions, to your team. Like you have to be on board, and it gets the buy-in, and people get to participate in that process. So then they automatically feel a part of something bigger than themselves without being asked to.
Sure. I love that. So this brings me to the next question. What is revenue cycle management and how is it related to relationship intelligence?
Yes, revenue cycle management, the big one. Bottom line, how do you know if you're doing well or not doing well? Revenue cycle management encompasses the entire process in a medical practice, from generating that revenue to the final payment, and then practice performance. So it takes it that next level from just traditional AR management. And it's so much more than just collecting a balance from a patient. It's measuring practice performance. It's how are you measuring up to industry standards? If you're not looking at these things, you don't know what you don't know. You don't know, are you healthy, or are you starting to get to a point where you're maybe ballooning a little bit based on your industry standards? So you take your practice management software, you take your key practice indicators, and then you take financials to calculate your percentages to your income to measure your practice operational health, so to speak, in the industry. And how does that tie into relationship intelligence? I have a real life example in working with an administrator in an office, and I was teaching how to do exactly just that. You have your monthly reporting, you have your KPIs, and a critical KPI in a successful practice is case acceptance. You need to know every patient that walks in the door, if they did not accept treatment that day, why and what follow-up you're doing for them, right? So that's a key part of the success of your practice. And sometimes if you're not measuring it, a doctor might say, wait a minute, I have a problem. My schedule's not full anymore. What's going on, right? So we want to try to prevent getting to that point by monitoring it or measuring it every month. And then once you start to see a change, either way, you can start to address it, right? So we are working with these monthly reports. Case acceptance was trending in the wrong direction over a 2-3 month period of time. Okay, now we're below what our average typically is, let alone the industry standard. We need to address this. Like, let's dive into this and figure out what might be going on. So then we start looking at individual treatment coordinators. What's individual case acceptance? And we were able to drill it down to one individual. And so we started by having an open conversation. Like, how do you think treatment plan is going? Are you noticing more acceptance or not? First of all, are they even aware? Do they have the self-awareness? And then, based on that response, go from there. And by starting to have these conversations and recognizing the change in her behavior and performance, we were able to have an objective conversation with her in her comfortability with treatment planning. And although she had been with the practice many years, a substantial amount of time, her comfortability and perspective of talking to patients about high dollar value treatment had changed. She didn't feel comfortable. She didn't feel that she was in the right position anymore. So by being able to drill it down to the root cause and having a constructive and open exploratory conversation with her, we were able to come to a good solution and then fix the problem, right? By getting somebody different in there. So by looking at what do we want, what qualities, behavior, strengths do we want in an individual, that's who we're going to seek out. We're going to seek out the next treatment coordinator that has these strong behaviors and traits, because that's an innate desire or ability to communicate with patients when it comes to treatment plans, the confidence to talk to patients about treatment plan, and the knowledge to instill the value in it, right? It's kind of a combination of all those things. So we sought out to hire the next individual for those key strengths. You hire that individual, first quarter, of the next year, case acceptance was already back up over 15% from where it ended at the end of the year, right? You can drill that down to a dollar amount. If your average case is $2,500 and your case acceptance was down 10, 15%, that's about, depending on the specialty, maybe 8 to a dozen cases. You do the math. It's 500 times 10. I mean, and that's just 1 month. Measuring key practice indicators and tracking percentages of your profitability allows, from a bigger perspective, like your manager, your administrator, your business manager, to hone in on things when they're going well and praise your team when they're going well, and then to be able to objectively approach a conversation when things aren't going.
Interesting. You're saying case acceptance rate is, how often do you walk into a practice and they have no idea what their case acceptance rate is? Because this is the terminology used in oral surgery, right? Right. In plastic surgery, we say, what is your lead conversion rate? Because everything is basically a lead from marketing or advertising. And most of the time I get the sense that I'm talking to somebody who's guessing. But what's your experience with that?
That's my experience as well. I'm pleasantly surprised when I come across a practice that can tell me right off the bat, our case acceptance is this, and we average this. Our recommendation for a specialty practice is 90% or above case acceptance. And if you're not, you need to maybe look into what's your history.
90% seems high. Is that because by and large these are referrals?
Depending on the practice, yes. And so 90%, I would say, is a good average, kind of like a starting point. What I was going to add on to that is to look at your practice history. So if your practice history has been consistently at 85% and your other matrix are healthy, that might be a healthy lead conversion percentage or case acceptance rate for you. Does that help to maybe clarify that?
There's a lot of conversation right now about sort of the marketing game changing for oral surgeons, sort of making the realization that a lot of them have referrals for things like wisdom teeth removal, but not necessarily dental implants or full mouth restoration or, some of the more aesthetic related procedures. And as a marketing agency, we've been talking a lot about sort of just moving away from the traditionally referred stuff and really focusing on just the aesthetic, sort of cash driven, less insurance driven type stuff. And so I'm excited to be having this conversation with you, because I think this conversation over the next 12 to 24 months is going to evolve as sort of the marketing aspect of oral surgery evolves as well.
Right. And I agree. I think the referral trend is changing, especially for elective medicine. People are recognizing that they have options, and that they don't have to go just one place. It's interesting. What is your opinion on, in the future, patients not relying so much on the referral, but going out to other resources like social media or Google to get their personal opinion for a referral?
Well, I think that's happening already. I also think that a lot of the general dentists are becoming super dentists, where they're either bringing in someone to do the implant or placing the implant themselves. And so less of the cash-based stuff is getting referred out. You have that piece of it. I do think that there's a whole segment of demographic where they used to get handed a business card to go make the referral. And now they go home and sort of Google that person and find out whether that's a good choice or not. Also, I think one of the issues as we market oral surgery practices, some of the larger practices have so many referrals coming in that when you're marketing them for something like wisdom teeth removal, we just don't move the needle. We move the needle and we can see where we move the needle, but they don't feel it in the practice. And maybe they're not measuring exactly where everybody's coming from. So until we close that gap, in order to have a healthy marketing relationship with the practice, we have to be able to establish value. And the way that Firm Media establishes value is we do our very best to tie ourselves to the revenue goals of the practice. That's hard to do with the wisdom teeth removal. We probably will see a sort of shift over to treating the aesthetic side of the oral surgery practice more like we do marketing for the plastic surgeons. And yes, people will be vetting them for that and looking at the reviews and looking on social media to see if they're legitimate or they exist. It's a weird phenomenon that someone will get a referral and then they'll Google something and then they'll land on your website and then they'll go over to social media. And if your social media is a ghost town, then there's something wrong with your practice, even though that's not really what that means. Right? Some practices just don't do social media, but it's an absolute must. It's social media is almost you had to have a business card in the past, right? Now you have to have social media. So,
I agree. And with that shift, would you say that you see the need for a patient experience being that much more superb than it was before?
Sure. I mean, there was a day where you just got a referral and you went from the referral, straight from your general dentist to whatever. I've had procedures done by periodontists. I've had a procedure done by an oral surgeon. I've taken the referrals when I was younger and just called the number and did the thing and didn't really judge whether it was a good experience or not. You just wasn't in that category. And now it's completely.
It was what it was.
Yeah. This is what it is. And, I don't think it's that way anymore. People are wanting to have, some people want to have luxurious experiences. People want to know if they want to have pain-free experiences. They want to have safe experiences.
What are they going to get out of it?
Sure.
Not just a referral.
So thank you for answering all of those questions. All of this is super compelling, and I'm looking forward to this episode being out. This is the point in the episode where we ask for your Ailm Essential Insight. This is the one takeaway that you want to leave our listeners with so that they can watch this and then take it and go apply it straight to their practice. What's the one thing that you think is the most important thing for specialty medical practices to know?
Gosh, if I had to give one thing, I would say learn how to go where others come from. Learn how to go to where others come from.
So I know what that means because you and I have talked about it, but say more about it.
Just as we mentioned earlier in the podcast, that there's not one strength or skill that makes one leader better than the other. What makes a strong, successful leader is when they have the ability to recognize their team members around them, how to fully utilize them, how to change their approach to make them more successful. When you build that into your day-to-day practices as a leader, that's what makes you more successful. Recognizing that it's not your way or the highway in how you communicate, approach other people, because not any two people are built exactly the same. So before you step into a conversation that might be, I call it a crucial conversation, you might take a step back and think, okay, how is this person going to approach or perceive my approach? Should I maybe change my approach so it's a little bit better received by that individual?
Sure.
That's an example of it anyway.
That's super great insight. Jamie, once again, thank you for being on the show today. I look forward to this episode being out, and I'm going to talk to you soon. Thank you.
Thank you.